In 2023, the Ministry of Health announced plans to begin procuring diagnostic, and today, government has formally adopted locally produced diagnostic kits into the national healthcare system following a series of validation studies.
In health, more especially HIV, before a product is used, they sit and do vigorous testing, field studies, lab studies, the pilots, until when they say this product is very good, it should be adopted. So today, Ministry of Health has adopted into the national testing algorithm use of a locally manufactured kits.
These kits are already being procured and distributed through the national medical stores, Right Honorable Prime Minister, to our facilities across the country. This marks a significant and historic step forward.
Officials say samples tested in health facilities demonstrated that the kits are safe, reliable and effective. The kits have since been approved by the National Drug Authority, and the manufacturing process has attained ISO 13485 certification, an internationally recognized standard for medical devices. Efforts are also underway to secure World Health Organization pre-qualification.
So there are several different standards that are taken through these GMP factories, and Microhim has gone through this to make sure that we assure people that they've gone through the proper certifications, beginning with our own National Drug Authority.
The manufacturers say they have the capacity to supply not only Uganda but also regional markets.
The capacity we have set up for you is enough to serve Uganda, is enough to serve East Africa, and by 2027, we will launch a plant that will serve the entire continent.
According to the Ministry of Health, Uganda currently imports nearly 99% of its medical supplies. This dependence became more evident during the COVID-19 pandemic, when global supply chain disruptions affected access to critical medical commodities.
For many years, Uganda's health sector has relied heavily on imported medical supplies. While these imports have supported service delivery, they have also exposed us to vulnerabilities ranging from supply chain disruptions and delays in access to essential commodities.
By investing in local manufacturing, we are taking control of our future and ensuring our health system remains functional even amidst global uncertainty.
According to different government officials, the adoption of locally made diagnostic kits aligns with the government's Buy Uganda, Build Uganda policy.
And so external funding is no longer guaranteed. Countries that depend heavily on foreign aid risk disruptions in essential services.
However, stakeholders note that more effort is needed to ensure that raw materials used in manufacturing are also secured locally to maximize the benefits of such initiatives.
We want to make sure that we liberate our African continent by making sure by 2030 we don't import a single raw material.
Malaria remains one of the leading causes of death in Uganda, while sickle cell disease continues to contribute to child mortality. Data from the Ministry of Health indicates that approximately 20,000 babies are born with sickle cell disease each year. Recently, government rolled out mandatory nationwide newborn screening in a bid to reduce under 5 deaths linked to the condition. Nobat at Kunda, NTV News.